Never agree to these 5 surgeries after 60 hidden risks doctors don't tell you. If you're watching this right now, listen carefully because most people over 60 don't die from surgery. They die from what happens after it, and no one ever warns them in time. I need you to stay with me until the end of this video. Before anything else, subscribe to the channel and turn on notifications, not because of numbers, but because what you're about to hear could genuinely change a life or death decision for you or someone you love. And I want you to comment below where you're watching from, because I actually read those comments, and sometimes the stories people share completely change the way I see medicine. Now let's begin. My name is Dr. David, a geriatric and surgical consultant with over 20 years inside operating rooms, intensive care units, and family meetings where one sentence can change an entire family's future. And today I want to talk about something most people only understand when it is already too late: surgery after 60. But before we go deeper, I want you to imagine something for a second. What if the biggest risk of surgery is not the operation itself, but the life you return to after it? Because here is the uncomfortable truth nobody explains clearly. A surgery being recommended does not mean it is automatically the right decision for your body. In older adults, the real question is never just, can we do it? The real question is, can your body survive what comes after? And I have seen this truth play out more times than I can count. 2 patients, same surgery, same diagnosis, same hospital. One walks out stronger, independent, grateful for a second chance. The other survives the surgery, but something quietly breaks afterward. Their strength, their memory, their independence, their identity. And families often say the same heartbreaking sentence: they were never the same again. And what most people don't realize is this: the surgeon is often not the difference. The body is. We call it frailty. And frailty is one of the most misunderstood concepts in modern medicine. Because aging does not just add years, it quietly removes resilience. The heart loses reserve power. The lungs recover more slowly. The kidneys clear medications less efficiently. And the brain becomes far more vulnerable than most families ever expect. There is even a medical condition for this called postoperative cognitive dysfunction, where patients wake up from surgery and never fully return to their previous mental baseline. But here is where most people get it wrong. Age alone is not the deciding factor. I have seen 85-year-olds recover beautifully and return to hiking, gardening, and independence. And I have seen 65-year-olds struggle for months after routine procedures. The real dividing line is not age, it is physiological reserve. Now let's go into something I need you to pay close attention to, because this is where decisions become life-changing. There are 5 categories of surgery in older adults where risk is often underestimated. Not because doctors are careless, but because the human body changes in ways that are easy to overlook. First, open-heart surgery in frail patients. Yes, it can be life-saving, but what most people never fully visualize is this: the heart is literally stopped. A machine takes over circulation. Every organ in the body is forced into survival mode at once. In a strong patient, the body adapts. But in frail older adults with kidney disease, diabetes, or cognitive decline, this stress can trigger stroke, kidney failure, prolonged ventilation, infection, and long-term cognitive decline. And here is something families are often shocked to learn. Recovery is not just about surviving the surgery, it is about surviving the inflammation storm afterward. That is why modern alternatives like TAVR, a catheter-based heart procedure that avoids opening the chest, have completely changed the risk equation for many patients. And the question becomes no longer, do I need surgery? But, is there a safer way to achieve the same outcome? Second, aggressive spinal surgery. I want you to pause for a moment and really think about this. How many older adults are told that spinal fusion with screws and rods is the only solution for chronic back pain? But here is what the data quietly shows. Complication rates in elderly patients can reach 30 to 40%. Blood clots, infections, hardware failure, and something called adjacent segment disease, where the spine begins to collapse above and below the surgical area because the natural mechanics of the body have been permanently altered. And yet, long-term studies often show something surprising. In many cases, surgery does not significantly outperform physical therapy and structured rehabilitation for pain relief. One spine surgeon once told me something I never forgot. The hardest decision in surgery is knowing when not to operate. Third, major cancer surgery. This is where emotion and medicine collide. Because when people hear the word cancer, the brain shuts down logic and switches to survival instinct. Remove it immediately. And sometimes that is absolutely correct. But major cancer surgeries, especially abdominal or pancreatic operations, are among the most physically demanding procedures in medicine. They can last 6 to 10 hours, followed by an intense recovery period that requires enormous physiological reserve. And here is the part most families never hear clearly. Sometimes the surgery removes the cancer successfully, but the body never recovers enough to enjoy the result. This is why modern oncology has shifted. It is no longer just about survival. It is about survival with quality of life. Sometimes radiation, targeted therapy, or careful monitoring creates a better overall outcome than aggressive surgery. Fourth, joint replacement in high-risk patients. Hip and knee replacements are truly life-changing for many people. They restore mobility, independence, dignity. But in patients over 75 with multiple chronic conditions, the risk profile changes dramatically. Blood clots, pneumonia, infections, prolonged immobility, and delayed recovery that can take away more strength than it restores. This is why preparation has become everything in modern surgery. We now focus on something called prehabilitation, building the body before surgery so it can survive the stress after it. Because a stronger body does not just recover better, it survives better. Fifth, emergency abdominal surgery. This is the most dangerous category, not because medicine fails, but because time disappears. There is no preparation, no optimization, no planning, only urgency. Conditions like bowel perforation or internal bleeding force the body into a crisis where every organ system is simultaneously overwhelmed. And in older adults, mortality rates can reach 30 to 50% in severe cases. But here is something critical. Many of these emergencies begin as small warning signs. Abdominal discomfort, bloating, changes in digestion, that are ignored until they become life-threatening. Now let me bring you to the most important part of this entire video, because this is where knowledge becomes power. You do not avoid surgery. That would be dangerous and incorrect. Surgery saves millions of lives. But you must stop being passive. You must stop assuming that recommended means best. Before any major surgery, you need to ask 4 questions that most patients never ask. What happens if I do nothing right now? Are there less invasive alternatives? What does recovery realistically look like for someone my age and condition? And the most important question, what is your complication rate in patients like me? And here is the truth most people don't realize. The way a surgeon responds to those questions tells you almost everything you need to know. Because modern medicine has changed more in the last 10 years than in the previous 50. Robotic surgery, catheter-based procedures, minimally invasive techniques, advanced medication strategies that can sometimes replace surgery entirely. But despite all of this progress, one truth has not changed. Medicine is not just about extending life. It is about preserving independence, dignity, and identity. And I want to end with a story that has stayed with me for years. A 71-year-old man came to me after being told he needed major heart surgery. 3 specialists gave the same recommendation. But when I spoke with him, I realized something important. He wasn't afraid of dying. He was afraid of disappearing while still alive, losing his memory, his independence, his identity. After a full evaluation, we chose a non-surgical approach using medication and rehabilitation. And 4 years later, he sent me a photo. He was hiking with his grandchildren, smiling, alive, fully himself. And that is the real message of this entire video. This is not about refusing surgery. It is about refusing blind decisions. Because a surgical recommendation is not a verdict. It is the beginning of a conversation. And in that conversation, you are not a passive patient. You are the decision maker. If this video made you think differently, subscribe now for more medical truth, senior health insights, and longevity knowledge most people never hear from a normal consultation. And now I want to ask you one final question. What is the one question you would ask your doctor before surgery? Comment it below, because that single question might one day change everything for you or someone you love.